Hi, welcome to Health Exchange. Today we're going to discuss the importance of personal protection and how our legislator informs their constituents in regards to arboviral diseases, where we're in an outbreak that we haven't seen of Eastern Equine or West Nile Virus since 2013. And with us today is Representative Kathy LaNatra. Welcome.
Thank you. Thank you for having me.
No, I'm so glad that you agreed to be on the show. In your districts, you have one of the most difficult districts for mosquito-borne diseases.
I do.
You've had multiple human cases in your districts. You have multiple isolates of Eastern Equine and West Nile Virus. As a state representative, how is it that you communicate to your constituents when you find out that there's new risks involved?
That there's a new risk. So I'm a new state representative. I was just sworn in January. So this is my first actual battle with EEE and all the viruses that we have. So the way that I try to get it out, we do have a Facebook page, we do have a website that we do. Our towns will do robocalls, which I think is very important as well. And that's mostly how we get it in. We do have constituents that call too that have concerns about, when they hear it on the radio or something, and we can give them the facts that we have.
That's wonderful. And part of it being an area, and I don't want to talk much about the legislation and the politics behind public health and mosquito control, but I really like to talk about personal prevention. What are some of the main things you tell your constituents and do that is so important for them to protect themselves at home?
Well, there's a lot of things that are very important, especially I'm a mother, I think of 4 children that play sports. They play sports outside. So making sure our practices are ending before dusk is a huge thing. So dusk to dawn is not a really good time to be out. We all know, we've all been out when we all grew up, we'd be out at night and we'd be slapping our legs, slapping our arms for mosquitoes. Insect repellent, very important. Not just the citronella candles, you really have to spray it on yourself. Even standing water, like 1/8 of an inch will start to breed mosquitoes. That's a big thing as well. So you want to be in at night, right? Unfortunately not by your fire pit, which we all really want to do, but we need to be safe. We need to be in at night. We need to spray. We need to use insect repellent, and I believe DEET is the best that has DEET in it. And any standing water that's around your yard, it's very important to discard it. Dump over those pails. If your kids are out in the sandbox playing with pails and they leave them up, make sure they're dumped out. Your dog bowls, don't leave them filled with water outside. Those are just some little things that we can do at home.
And I think going on eliminating water, I know I've lived through a burying in a child, which all the viewers know, and I find it hard that 1/8 of an inch of water, whether it's my clogged drain spout or my grill cover. My husband, husband is the past 3 weeks, you have a little bit of water on your grill cover. What is wrong with you, honey? So it being mindful of it, I think, is so important. You are so correct on that. In other areas, you touched on sports. In the surveillance and response plans that the state puts out as guidelines for the municipalities, many times there's a lot of pushback
on the sports
from sports organizations. How would you recommend for parents or even those serving as town employees to handle that pushback?
Well, I know previous to being a state representative, I was a selectman in the town of Kingston, and I do remember in the past that we would make sure that our KYSO was vigilant, our youth sports organization was vigilant about making sure that our practices, and we would close the fields. I was also on the rec department. We would close the fields. But parents need to band together. You just don't go. You don't go. What is more important than your child's safety, your child's life, or your own? It's not just children. It's our coaches and it's our parents that are watching. So you need to push back as a parent, we won't be on up to dusk. Another thing I wanted to mention too about the prevention, to go back for a second, long pants. I know it's warm, but long pants and long sleeves as well.
And we don't have to wear heavy jeans.
No.
In the 21st century,
Right.
they have some pretty light.
Cotton, right, they have some cotton.
They have some pretty light and stylish.
Yes, very
pants
stylish.
for summer. So I'm guilty of not doing the long pants, and I know the risk.
I know. It's challenging when it's been, I mean, today was 97 in Boston, so I understand that challenge. I've had some sun issues, so I actually wear long sleeves most of the summer, but they're cotton, and it makes a big difference.
It does. And with I think it's great that the close fields and do things and repel, and indeed, if I remember correctly, we have picaridin and some EPA approved lemon eucalyptus. Would you recommend those too?
So it's interesting that you probably know more about that than I do. So if you could, I've heard of lemon eucalyptus. The one you said before that I really am not familiar with. So if you could explain that, that would be helpful, I think, to everybody.
Picaridin is a newer active ingredient.
Okay.
It was originally designed to repel ticks, but they've found that not only does it repel ticks, that it does a really nice job at repelling mosquitoes too, and it's not greasy feeling, and it doesn't smell.
Would we use this on our pets? So we have a spray at home because we have pets, and it's the eucalyptus, the lemon. We spray that on our pets. Would this be something that they would put on a flea collar or a tick collar?
Picaridin is found in a lot of everyday products.
Okay, it is.
In the homes, along with permethrin.
Okay.
It really is. I can't say if I'd buy the aerosol and spray it on a pet, but that I don't know. And I know that when my niece and nephew were born, that they had come out with a cream. And I learned through many seminars with the state and Dr. Allen, Kevin Cranston, that the cream just acts as a barrier for little kids, so the active ingredient doesn't go in the bloodstream as fast. But
that's interesting.
It's only good for 2-3 hours rather than the full 6 to 10 hours, depending on whether you're playing sports and sweating or on swimming for reapplication. But
so would it sweat off? Do you think?
I think any of the repellents tend
you just have to. It's similar to sunscreen. You need to reapply, right?
Reapply and reapply again, and are you getting bit? Are you getting bit? I ask my kids all the time, are you getting bit? Yes, okay, let's reapply.
It's very important. My children, I think our children need to be aware as well. We're aware as adults, but I think we need to drill into them. If you do feel like you're getting bit, it's time to come in, or you need to do something. And I've drilled into my 12 and 13-year-old. We were outside at the fire pit, and as soon as she's like, oh, mosquito, and in we went. So I think it's important that they're self-aware.
Yeah, absolutely. And I have to agree with Rep. LaNatra on this one. Don't be afraid to educate your kids. Education's knowledge, and it will help save their lives and your own loved ones' lives, and all of our loved ones. It's just so important to be proactive, and just with the state. And I understand it's your first year, but being a state representative, how many phone calls do you get that I love the spraying, thank you so much, can they spray again, and the opposition to it? Is there a lot of opposition to?
I think this year, I know this year, a lot of people wanted the spraying, you being one, and that's how I became involved, hearing your story and meeting you, and we did advocate for the aerial spraying. I did have some pushback, but my argument is, we talked about this before we came on air, is I'm a mother of 4, and I'm going to advocate for my family as well as your family and your safety. My motto in my home is safety comes first, and that it's drilled in my 25-year-old's head, it's drilled in my 12-year-old's head, and I feel that way for my entire district and all of my constituents. Their safety comes first.
It's very important, and when I know many don't believe that a mosquito can cause a safety risk, but they really do. So please pay attention to everybody that is trying to inform you with factual information of the importance of taken personal precautions, and listening to the facts that are giving out when we have to declare a state of emergency. Do you feel there's more that we can do as homeowners and constituents, and even so on the state level to make mosquito control better, to make the message more clear, more education? Is there anything that we could do?
I do think education, there needs to be more education on it, I do, and I think it needs to be more readily available. I think, in the schools, we need to discuss it to the children that go to sports after school, and they'll come home knowing my children, what they learn in school, they're going to bring home to the dinner table and tell the parents, and I think education is key for almost anything. And I know we're talking about mosquitoes now, but we also have the tick. I'm in a house, my husband's had Lyme, I've had Lyme. So there's a lot of dangers out there that we didn't necessarily have or had the knowledge of when we were growing up, that our children need to know, and we need to relearn or learn as well along with them. But again, as I said, I'm new to the legislature. So what more the state can do and as I can do as a legislator, I'm not sure yet, but I'm learning as I learn more about EEE and the viruses along with mosquitoes and ticks. We'll see what needs to be done and do it.
No, I believe it. And you mentioned education, and just DPH has a clearinghouse where you can order information from, but it's always very, very limited. I think a lot of times education comes down to funding, whether it's our school districts in general and our regular operating budgets, our buses. So, and one more thing, are there incentives to have coaches come to be educated, to talk to their parents and do different things where if we educate one group, they can educate the next, and then the children can come back to the dinner table?
That's a great idea. I'm not really sure, but what coaches, I've been a coach for years and I've never been approached. It's just the youth sports organization, we're not doing this because of this. But we weren't specifically had a class but that's something that should be looked at actually, or just the sports organizations alone. I know that there's more coach training now than there was years ago, and we could add that into that coach training. That would be something that would be great to bring up to the sports organizations.
Yeah, I've coached, but I've coached years ago, and I always coached basketball, which is in the winter, and we're not traveling through the woods to worry about the ticks that are out year round. They really are. They're out year round, guys.
They are, yes.
And so I never had that experience, but I know now that I'm involved with Cub Scouts and Girl Scouts, it's mandatory my girls have sunscreen and repellent on.
And you're out all the time because you do a lot with your scouts.
We do. We're out it's mandatory, and we have a permission slip because repellent's almost like a medication. Without that signature, you can't get reapplied, even if the guardian applied before him. But it's so important.
It is important.
I know that our troop met today, and we were with the humidity and the small amount of overcast. We ended up going inside early because the mosquitoes were already out.
They were already out.
The mosquitoes in southeastern Mass never cease to amaze me.
Do you find that they come out when it's more humid?
When it's humid, there tends to be a little bit of overcast.
Okay.
And they come out in the overcast, and if the shaded areas, they'll always come out for a blood meal, or if you in your bushes or gardening and different things, they tend to rest in there. So you have the chance of being bit all the time.
That's interesting that they hide in the garden. So there's a lot of people that garden. I used to be one of them. But that's another reason to wear long sleeves, right?
And we do. And
long pants.
And until the second hard frost in my house, we sunscreen, we do repellent, and then we go to the bus stop. Our bus stop also has a catch basin in there, flying up from the catch basin.
Yeah.
So they're out at all times. It's just, I dislike mosquitoes. They carry terrible diseases, but they're fascinating little creatures at the same time. They really are. They really are. But it's so scary.
It is scary.
And then I noticed this year there seemed to be an increase in fear. Almost to the point where the general populace was panicking.
Mm-hmm.
Did you find that to be true as a legislator and working with the public when it came to the mosquito-borne diseases?
That there was there is a general fear. I will say there's a general fear. I think that this year, it's like you had said in your opening statement, that it's been one of the worst years we've ever had. So when people hear that, they get more fearful, you know, and there's just so many things to be fearful of that I think that sometimes, I don't want to say it's blown out of proportion because it's not, and that's not what I mean, that they go right to the worst.
Yeah.
Right, so that's what I mean, like they jump to the worst, and you know, there are some things that we can use for prevention. So I think we need to think of that as well before that. But like you did say, this is the worst it's ever been. So we need to be more proactive.
I agree. And I want to word my question where it's not political, because public health shouldn't at all ever be political. And the way it was on the tip of my tongue wasn't at all what I had meant. So what about some of the symptoms if they believe they may have contracted a mosquito-borne virus? What would some of the symptoms be?
Well, I know from what I've read and researched, it could be as little as starting with a fever, right? It could be a fever, or it could mimic the flu. And that is similar to not only mosquito-borne, it's also very similar to Lyme.
Yep.
You know, it's very similar. So it's very easy to misdiagnose. And I'm going to use my husband as an example with his Lyme. It was in the summer, and he had the chills, he had a fever, he felt like he had the flu, and he went to the doctor, and the doctor said, "Oh, you have the flu." And I said, "You don't have the flu. You're not getting the flu in July." And my husband said to that doctor, "Can you test me for Lyme, because sometimes I dream that there's bugs crawling around in my head." Now, you have to know what my husband does for a living. My husband's a police officer, but we have a canine dog, so he does search and rescue with that canine dog. So he's in the woods all the time. He would not have been tested unless he demanded to be tested. So again, if you are bit and you suspect, you know, again, err on the side of caution. You demand that test. You demand that test. You don't take a summer flu, or I don't, maybe there is a summer flu, I don't really know, but I always think a flu starts in October, and you know.
And in my 14 years of experience with arboviral diseases, there's no such thing as summer flu.
Okay.
You have one of the 17 arthropod diseases that are just so well known to the state agencies and the researchers and then the colleges, yet not necessarily so well known to our local clinics and in the medical field. Like Adriana was misdiagnosed. We were told we were paranoid, even though a gentleman had just passed away down the road from Tripoli, and we were sent home. So we no longer go there. So we go to a clinic over in Compass in East Bridgewater. The staff and the so knowledgeable and fantastic. But I had asked them, why don't you have posters up for arboviral diseases, ticks, and others? Like, they're free. DPH gives them out. I know they send you information. And they were like, "Oh, our marketing companies make those decisions." And I was like, "But that post is about influenza. It's August in the middle of a Triple-E outbreak." And I was just amazed that.
And this is the community we live in. We live in a community that is very high density of mosquitoes. You know, so we have many swamps. And you would think in this district, I'm going to say my district, my 12th district, 12th district, that they would be more aware.
And it's just, it amazes me. And it's been crossing my mind over and over since finding out that the doctors don't have a say in what poster they can put up, and it's the marketing company. And I don't even know if the marketing companies in Massachusetts, I haven't investigated this far, but how could we help our medical field be more aware? Like, how do you do that? You're the doctor, you went to school, I understand that. However, you're missing the facts of getting education out.
Right.
Like, how would we fix that?
That's a good question. It's a good question that I don't have the answer of, but you would. This is what I tend to believe, is that they're in their little bubble and they're doing their job and they're very busy. And I do believe it's probably a marketing company that does it, but doesn't come all the time because they're a business as well. So that marketing company isn't coming all the time, and that marketing company could be from, say, California, and is not really aware of what's happening here in our district, in our area. Sometimes it's just letting them know. I really do. I just think it's letting them know. They must get these notices that I get, that we're in a high-risk situation, I would hope, but again, it's...
I know my kid's pediatrician knew that he was in high risk, and if X amount of signs existed, that either a spinal tap or blood work needed to be sent to the state lab. So I was just amazed that there's so many pamphlets out there, and there's so many posters
They're
that...
just not getting out to the right people.
The parents might not take them home with them, but I know when I'm bored in the doctor's office, when he's running an hour and a half behind, I've read through everything that's available in the doctor's office. I think that they're just a great resource to help pass that education on.
And I had a thought when you were saying that, it would be nice if the school nurses sent them home, those pamphlets home.
I know where to get the school nurses free materials. That's a great idea.
That's a really good, yes. Well, you came from when you were talking, a little light bulb went off, but that would be great.
That's fantastic.
So these are things, it's really communication. Everything's communication in education, So it's communicating with the school boards, the school committees, and they in turn can bring it to the principals, to bring it to the nurses and get that material home. The doctors, it's communication with the medical field. We're this year, one of the freshman representatives is an ER doctor. I'm going to bring this up to him when I see him tomorrow and ask how that can happen. And what his thoughts are on that.
That's super cool.
Yeah.
I like that. Thank you so much.
You're welcome.
I've had a lot of light bulbs go off during our interview. It's fascinating. I love it. Great ideas. And you've talked a lot about ticks, and they fall into tick-borne diseases, fall into the arboviral disease categories. And is prevention the same for mosquitoes and ticks?
It is to cover up. It really is. Unfortunately, ticks are available all the time, but it's to stay out of long grass as well is one of the things. If you have pets, make sure you're combing out your pets at night, because a lot of times they come in on pets if you have outdoor pets.
Does repellent work against ticks?
So that I'm not sure. I've heard that DEET works against ticks, but I'm not really sure. We have, again, that we have the organic sprays that we use on our pets and that we use on ourselves that I got at farmers market. So I'm hoping it's working. Knock on wood. We've all been healthy, so we do use that. I'm not sure really what it's still happening. I mean, people are being diagnosed all the time. People are being misdiagnosed with that as well,
and it's just
told something else for years.
And I've known just from education and being a part of research in the state about Powassan fever and about and others. We have seven extremely horrifying diseases.
They just mentioned another one yesterday on the news, and I didn't get a chance to hear the whole thing, but
they they're devastating.
They are
and
devastating.
I know in your district, you've had non-travel related deaths of spotty market rodent fever in the past 15 years, along with the spike of Tripoli and Sam Telford at Tufts, I know, has identified 2 new bacteria that ticks transmit. And it's scary. And one of the things that scares me personally most about ticks is that the Lone Star tick has made itself prevalent here, and it transmits multiple viruses at the same time.
So that's what they brought up on the news the other day, the Lone Star tick. Because usually you just think deer tick, the really tiny deer tick, and if you see a big tick, you're like, oh no, it's not that little one. But you really need to be vigilant with the ticks.
The Lone Star tick is tinier than the deer tick.
Oh, is that the one that's like that? Yes.
It's like motus.
So you can't even see it.
It's so small, you barely find them after he's been feeding on you.
If
And-
I don't go home scratching my head after this, Kim, I'm getting itchy now just talking to you.
I'm sorry, but ticks are not fascinating. I don't like ticks.
No, I don't
ticks at
either.
all. I like mosquitoes, but only the female mosquito bites, and the male mosquitoes, if aren't horrible, they pollinate and stuff. I don't mind them in my garden, in my flower beds, but without a microscope, you can't tell them apart.
Oh,
So it's not useful for the general populace.
no.
So if anything you could stress as we're getting ready to end the show, what the constituents should do, if I remember correctly, sometimes I have young timers, is mosquito repellent, eliminating water, during dawn to dusk,
dusk to dawn,
dusk
to dawn, yeah.
dusk to dawn, and
Covering up.
covering up.
We want to cover up.
And covering up. Is there anything else?
Just to, be aware of what's going on. Listen to the news.
Okay. I'd like to thank you for coming on the show.
Oh, thank you for having me.
I think it was a great discussion,
I
and
do as well.
I learned some things and had some great ideas. It's fascinating. I know that you'll implement them, which I find extremely fascinating, and I know that even Rep. Cutler's district and the relationship that you have with your peers, even being newer to the legislator, that they'll follow your lead. I find that fascinating. That's wonderful.
Rep. Cutler's a great representative.
So we'd like
great
to
partner.
just to thank you guys for that. So please be vigilant. Most of us use social media. Your representatives are on Facebook. They are putting the information out there, so don't forget to like their page so it can show up in your news feed. You have the options of calling the offices to get more. Your local municipalities will have answers for you. And please don't panic. Yes, we're in a serious situation. However, we're using the tools we have in our toolbox to ensure that we're doing the best we can for public health. And just to remember to take personal precautions, because personal responsibility is a big deal too. And really, prevention starts at home. Just like Rep. LaNatra said, to do safety first. It's very important. Thank you for viewing the show, and we look forward to seeing you next time. Everybody have a great week.